These are modern problems, and due to concerns, we've had to sadly announce today that the 9Health Fair is scheduled to start in a few weeks are now being postponed. So the CEO of the 9Health Fair, Gary Drews, and our 9Health expert, Dr. Powell Coley, are with us now. Gary, this is a sad announcement to make. So many people count on the health fair to make sure that they are healthy, but to make sure people are healthy, getting people together in big groups is nowhere to be right now.
That's exactly right. So 9Health is in the business of prevention, not spreading disease. So that's foremost. And when you look at the number of people involved, the number of volunteers, we have 40,000 participants, 10,000 volunteers, many of whom are medical professionals. We need them to stay healthy, of course. And the people most vulnerable are folks 60 and older and those with medical conditions. So that's pretty much what the health fair serves. And so we took the extraordinary precaution to postpone them.
So that means we'll be coming up with options for people to maybe stay healthy in another way besides coming together and visiting the health fair.
Absolutely. So, of course, we're looking at postponing the fairs to perhaps later this fall. But we are also looking at alternatives for being able to get your blood screened in other ways. We're working with Quest Labs on that as we speak. And then, as a matter of course, we are realizing that prevention happens every day. And so we're doing things every day. So, for instance, 9Health has a online mental health screening for anxiety, which I would urge you to take after your last session here on the stock market. And, and other services include creating a landing page with frequently asked questions that you can go to at 9healthfair.org, and town hall meetings, e-town hall meetings, so that we can have folks like Dr. Coley on the air, basically interactive through either Facebook or other means. And this service right here of helping provide Dr. Coley to the public is a huge educational endeavor.
Sure. Yeah, and we're hearing from you. I mean, we're, postponing the 9Health Fair, but then we were just talking during the break, we're hearing the mayor who's saying, come to the parade that's coming up for St. Patrick's Day. It's just kind of getting like mixed signals from different places. What can you tell us about where we should be avoiding and what those risks are?
So I think the prevention measures that we can pursue can really be divided into individual prevention measures, and that's the things we've been talking about. Hand washing, covering your cough. At this point, I would say not sharing your utensils, even with family members, things like that are important prevention measures. And then there's also community level prevention measures. And we're starting to see a shift in the past few days of really targeting these community level prevention measures, which includes avoiding things like crowded public places, trying not to congregate in places, canceling conferences, avoiding travels, avoiding cruise ships. And I think it's a bit of a transition. So the mayor did send that message this morning, but that message was really meant for the general population. When we're talking about an at-risk population like the type that serves our health fair, it's important to keep that in mind. The second thing I would say is that in the next couple of weeks, we will see even the healthy population starting to be on guard about those community events, because they're the ones that are going to be spreading the disease to the at-risk population. So we're all in this together. This is our common enemy, and I think this is the time we all need to band together and protect that at-risk population by all of us doing the right behaviors.
Isn't that the truth? I mean, I know this is tough on you guys, but if we're able to do it in the fall, it'll be great. It'll be wonderful. People will come. They'll feel safe. You start to see things, and we all see our own pattern. I mean, like I actually cleaned the inside of my car this weekend. I never do the inside, but we all do. Like, you go places and you're noticing people are changing behaviors. So it is that idea of coming together.
So I actually see this as a silver lining, because it's taught us so much about our health and empowered us to really make a difference in what this virus does, because we're all going to be part of how it spreads in our community. So every little step counts.
We can be stronger.
You've made yourself available quite a bit on the air, but tell us about some of the other ways that people have been able to reach out or at least understand some of the information you have for them.
Yeah. Yep. So we have a FAQ. We also online on our it's 9Health News. 9news.com/coronavirus, and also on the 9Health website as well. And we also have a new health line that is manned with volunteers from 4 to 6 p.m. These are medically trained volunteers, physicians, and nurses. So please call us with your questions, and of course text us as well.
All right. Well, Gary, good luck putting together what will be a very interesting evolution of this year's 9Health Fair for the spring. We'll keep an eye on it. We'll keep people posted. Powell, thanks for all that you've done for everyone.
Thank you.